Representatives from FEMA say they're doing all they can to help Massachusetts with the COVID-19 outbreak. Western Mass News reporter Leon Purvis spoke with a representative from FEMA. He joins us live in studio with more. Leon?
Jordan, Captain Russell Webster spoke about PPE supply, the Holyoke Soldiers Home, and what's next once the curve is flat. Captain Russell Webster of the Federal Emergency Management Agency says his organization has eyes on Massachusetts. The group supports Governor Charlie Baker's stay-at-home advisory. He also praises the recent pact made by Northeast states that are now working together to purchase personal protective equipment.
I'm heartened by the fact that multiple states have joined together to create more firmer unions of capability for COVID-19, because there's no one part of this whole of government effort.
Webster says FEMA tries to get as much PPE as it can from overseas, but he is not going to sugarcoat the reality they're dealing with.
This is a global crisis, and I'm not going to confuse the dialogue by saying there's enough N95 masks.
Webster says FEMA tries to support nursing homes all over Massachusetts. If the Holyoke Soldiers Home asks them for assistance, they have the resources to help them out.
The capability that we've made available is for them, if they choose, to decompress portions of the Holyoke Soldiers Home into VA medical facility.
As far as what's next, they're preparing for what could happen, like a second wave of cases. There is also a lot of what-ifs they have to prepare for. Like if a natural disaster were to occur, what would the response be like with social distancing?
How will we evacuate people in a flooding circumstance like Irene or Sandy or in a hurricane and maintain 6 feet of distance? How much extra sheltering space will we require?
FEMA also says more than 200 workers are deployed to fight the virus. Usually that number is around 60 for a disaster. They say they have never seen anything like this before. In studio, Leon Purvis, Western Mass News.